Well, welcome to our Sunday specials. Nigeria's effort to eradicate malaria may not yield the desired results soon as it appears as if there are new strains of the parasite that have become resistant to medications. Also, lack of testing among symptomatic people have increased the prevalence of malaria in Nigeria. TIJESU News correspondent TIJESU Adeoye takes a look at this new strain of malaria and some preventive measures.
Malaria is a major public health concern in Nigeria, with an estimated 68 million cases and 194,000 deaths recorded in 2021 alone due to the disease. According to the World Health Organization, Nigeria has the highest burden of malaria globally, accounting for nearly 27% of the global malaria burden, and accounts for 20% of all deaths in children under the age of 5 years in 2021. There are 5 types of malaria parasites, and they are differentiated by their morphology. Of the 5, Plasmodium falciparum causes severe potential life-threatening malaria. It also happens to be responsible for more than 95% of malaria cases in Nigeria.
It's an issue of resistance. In some other African countries, we are beginning to see resistance, like in Kenya and Eritrea. But in Nigeria, though there is no resistance, people already, the resistance strain, mutant strain, have been documented in some laboratory in Nigeria. So there is a resistance strain that is there, but a confirmed resistance to artemisinin has not been documented. However, in research laboratory, we know the resistance strain is available, is moving around in the country now.
In 2005, Nigeria officially changed the treatment of malaria from chloroquine to artemisinin-based combination therapy. The change was due to the rising resistance of malaria parasites to chloroquine, with hospitals seeing a doubling in deaths due to malaria. However, there is now reawakened concern that the artemisinin-based treatments may have become resistant to the new strain of malaria parasites, which now causes a setback to the long global struggle to roll back malaria.
The main malaria drug, that's artemisinin combination therapy, luckily for us, is still very effective in Nigeria, and it's working. However, we still have problem in managing malaria. People are not being guided by following the guidelines on treatment of malaria, that is using artemisinin combination therapy. There's still a lot of monotherapy all over the country. People are still using chloroquine despite the campaign. And so with that, chloroquine has been resistant and increasing, so it's compromising treatment.
For most Nigerians, fever, joint pain, and headache are the common signs of malaria. People hardly take time to conduct a clinical test before proceeding to neighborhood pharmacy to purchase anti-malaria drugs to manage the symptoms without a prescription. These drugs are not expensive and easy to buy over the counter, with an average cost of 1,500 naira for a packet of anti-malaria medicine.
It's very important that before you start medication, you should see your physician, yes, see your pharmacist. If need be, they'll direct you to conduct certain tests. So that will form a basis for diagnosis, and then can proceed to use medications for it.
Although most people testify to getting relief after a few days, but they are not cured and later begin to show symptoms. This is now a major concern to the war against malaria in Nigeria. We went to the streets to ask Nigerians their thoughts on self-prescription.
When I start feeling down and joint pains, then I know it's malaria, and sometimes I don't go to the clinic at all. I do my self-medications. I just take drugs from the pharmacies, or sometimes I just go to the pharmacy and tell them what is wrong with me, and they'll just give me drugs to take.
Working, but you cannot cannot kill the disease. It's just subsidize the disease.
Before now, I think malaria, once you take drugs, it goes well. It's like the mosquitoes have rebelled and they are taking it very serious these days.
The way I will start treat my malaria is I will go check up. If I go check up and I observe that malaria is disturbing me, I will go to hospital to go and buy the medicine.
Here's what you can do to fight the spread of malaria. Keep your surroundings clean, eradicate puddles and pools, sleep under insecticide-treated nets, and spray your house regularly with insecticides. Visit a health facility to confirm you have malaria first before treatment. Take your anti-malaria drugs as prescribed. The World Health Organization recommends that you should be tested for malaria, and the test must be positive before you take any malaria drugs. Also, not every fever is malaria, and you may be doing yourself more harm than good when you take acts without a confirmatory test. The war against malaria is on, and you have a part in the global fight to roll back malaria. TIJESU ADEOYE, TVC News, Abuja.